this lesson, we're going to talk about syndrome of inappropriate antidiuretic hormone, or SIADH. All right. The name basically tells you exactly what's going on. Really, it should be called syndrome of excessive ADH, but we'll call it syndrome of inappropriate ADH because that's what it's referred to as. But just think of it as excessive ADH. So just like the name suggests, SIADH is a condition of excessive secretion of the ADH hormone from the posterior pituitary gland in the brain. Remember that diuresis means to urinate. Anti means no. So antidiuretic hormone makes you not pee. All right. Or it makes the kidneys retain water. So if you have excessive ADH, all right, we have a lot of ADH going on, we're going to start to see crazy volume overload and retention, essentially. It's most commonly caused by some sort of brain injury like trauma or tumors or anything that causes swelling in the brain. All right, it puts pressure on the pituitary gland and could cause damage. It could also be caused by infection or even some kinds of medications. So the patient's urine output will drop dramatically and will be extremely concentrated. It will be dark and almost brown like you see here, and it could almost look like tea-colored, like a dark tea-colored. And we'll see a urine-specific gravity of greater than 1.032. So remember, the specific gravity of water is 1, and urine is usually between 1.010 to 1.025. So we're seeing this rise, this spike in urine specific gravity. The more closer to 1, the more dilute. So when we start to see it go up and above 1.032, it's extremely concentrated. Now, when they're retaining that much water, they begin to have serious fluid volume overload. So we'll see hypertension as the preload increases, right? We got all this fluid volume overload. So here's our heart. So our preload's increasing. We have all this extra blood in here. And so we're going to start to see signs of heart failure like crackles in the lungs and JVD, which is jugular venous distension. So you'll see the jugular vein. Here's the patient's neck. You see the jugular vein pulsating right here in the neck because the blood volume is so high. Because of all the excess water in the blood volume, everything gets diluted out. So we see significant hyponatremia, which can be very neurotoxic. So we likely see neuro changes like altered level of consciousness. We could even see seizures. All right. And even coma because of hyponatremia and water intoxication. Our normal sodium, right, we want 135. Your sodium can get down into the 120s here, and that can start to become very neurotoxic or bad for the brain. Plus, remember, this may also have been a neurogenic source, so we could see symptoms of that as well. We'll also see the BUN drop, as well as the hematocrit drop because of the dilution of the blood, and that's called dilutional anemia. What is our therapeutic management? Well, management of SIADH first and foremost requires frequent cardiac and neurological examination. The volume overload and hyponatremia can cause significant cardiac effects and neuro changes. We also want to monitor their intake and outputs very, very closely. Like we always say, do it on every patient, but with these patients, you better be doing it. You also need to be getting daily weights. And keep in mind that you must be consistent to get really accurate weights. And 1 kilogram of body weight equals 1 liter of fluid. So we want to be monitoring that really closely. They're already excessively volume overloaded, so we need to restrict their intake, and we'll also give supplemental sodium. Now, one of the ways we can give supplemental sodium is through very hypertonic saline, which would be like 1.5 NS all the way up to 3% NS. So rather than just our 0.9 normal saline, which is what we usually give, 0.9 normal saline, with this one we're giving 3% saline, and it needs to be through a central line. Okay, it's a lot of that's a very hypertonic solution. Okay, we also give diuretics to get some of the fluid off and replace the electrolytes as needed. Obviously, we're basing that on our lab values and what we're seeing, and then giving replacement electrolytes as needed. Ultimately, we need to figure out what caused it and treat the situation as best we can. So the priority nursing concepts for a patient with SIADH are fluid electrolyte balance, hormone regulation, and intracranial regulation. We need to monitor their electrolytes and replace sodium and restrict fluids. Okay. Remember, this is not only likely a neurological issue, but that hyponatremia and water intoxication can also cause seizures and changes in level of consciousness. So we want to watch that as well. Make sure you check out the care plan and all the other resources with this lesson so you can really get it to all start clicking together. SIADH, diabetes insipidus, they're the exact opposite. So make sure you pull them up together and kind of compare them, because it's really going to help you understand that hormone and how it works better. So let's recap really quickly. SIADH, or syndrome of inappropriate antidiuretic hormone, is a condition of excessive ADH secretion caused usually by some sort of neurological injury or infection, like cerebral edema or a possible infection. It leads to massive water retention. Okay, and that leads to fluid volume overload. Okay, then that leads to hyponatremia and what's called dilutional anemia. Plus, you're going to see signs of hypertension and signs of heart failure. We want to replace sodium and other electrolytes as needed based on our lab values. We want to restrict fluids and really stay on top of that and monitor that. Now, we're going to keep strict intake and output measurements, including hourly urine output and urine-specific gravities. So you need to learn how to do it, learn how to check those, and then do your daily weights as well, making sure that you're staying very consistent. All right, guys, that is the core concepts you need to understand about syndrome of inappropriate ADH. You'll see that diabetes insipidus is the exact opposite of this. Please review them together. Make sure you dive into all the other resources here to really understand this, because it's going to make a lot of other things click for you. All right, guys, I want you to go out and be your best selves today. And as always, happy nursing.